for you.
Okay. Hi, Lisa King here, Palm Beach Atlantic School of Nursing. I'm here with Chris Cutolo, who's a pharmacist and owner of Gardens Drugs. Chris, would you like to introduce yourself to the school and your background, a little bit about yourself?
Sure. My name's Chris Cutolo. I have a PharmD from Nova Southeastern in pharmacy. I've been out of school practicing for about 8 years now, and I recently purchased the pharmacy I work at back in December, so it's been about 3 months now.
Okay, great. What are some of the challenges that face you owning an independent pharmacy when compared to like a CVS or a Walgreens? Do you have special challenges or any differences?
Yeah, there's a lot of differences between working here and with the CVS. A lot of them are just basic management. We have to worry about things like the rent, like paying electricity, everything that a regular business owner would have to worry about that you wouldn't be burdened with. The corporation would deal with most of those things. Also, we have to deal with all the insurance contracting. That's probably our biggest challenge, is dealing with the contracting, the reimbursements, things like that. So there's a lot more work, owning the pharmacy as opposed to just working for them.
Has the Affordable Care Act presented additional problems?
I don't know. It's hard to tell. There's some people that it seems to have worked out very well for, and they come in and tell me that they were able to get insurance, they couldn't get it before. Other people, more commonly, at least in this area, complain about it raising their premiums, and I honestly don't even know what to believe when it comes to that, what's really responsible for it. So I couldn't tell you. I could just tell you that since it has happened, reimbursements in general have decreased. And I don't know how much of it is because of that, how much is it because of other things, other factors. Also, medication prices have gone up dramatically. And again, I don't know if it's directly because of that or just a random change.
Right.
So
what type of patient demographic do you service here? Is it mostly elderly people, or is it a wide range of patients?
It's a pretty wide range. We do in this area have a large retired community, so there are a lot of elderly. In general, in the pharmacy, we kind of run into a lot of elderly. But we also do some specialty types of medications. Some of them are like compounded medications, so we do get a lot of pediatric medicines that they're looking for medications that are only available in adult dosages. And we do something called compounding, where we make them into lower dosages. Also, we do the same thing for veterinary. And then also we have a lot of women with hormone replacement therapies.
And that's something that sets you apart from like a big chain pharmacy like a Walgreens or CVS. They don't do compounding, do they?
Not very frequently. No, they do not.
Okay. Have you worked in other communities besides Palm Beach Gardens? Where did you work before?
Before working here, I worked for Walgreens for about 7 years. Some of that was here in Palm Beach Gardens. Some of it was spread out between Martin County, Palm Beach County, and some Port St. Lucie County, but it's been mostly here in Palm Beach Gardens.
Do you notice any differences between Palm Beach County versus Broward, like in the needs of the community?
I haven't worked in Broward County, but there's definitely differences between Palm Beach Gardens, and if you just go into Riviera Beach, there's differences there. There's differences in parts of West Palm Beach. There will be a lot of differences. So if you go a little bit, a few miles one way or the other, it will change.
Yes. How many hours do you work per week there, would you say? A lot.
60 to 70 hours right now.
As a pharmacist, and then you have the business and then
no, we're open. I try as much as I can to work just as a pharmacist while we're open, although sometimes these jobs overlap. So the store is open 54 hours a week. So I work all those hours, so those 54 hours open, and then still working after they close there, so probably at least 60 hours a week.
Have you noticed like a need in the community that's not being met?
Yeah, the thing that I see a lot of is certain types of medical equipment. Um, People having trouble getting those. Also, certain types of nebulizer treatments, certain types of some more expensive medications. These are medications that Medicare Part B was generally covering, and some of them, because Medicare now has something called a competitive bidding, very few places actually do those type of certain wheelchairs, walkers, things like that. People have trouble getting those covered.
Okay. Is there anything you do to facilitate it, like deal with the insurance companies on their behalf or anything like that?
Not for that, because Medicare makes you do what's called like a competitive bid. So they have like one store maybe in an area that is allowed to bill Medicare for it. So they're trying to drive them all into one place.
Location.
And yeah, so the idea being that if one, as before, you'd have 20 places and maybe they all fill 10 walkers. Now they're like, well, we'll have one place, they'll do 200 of them. We'll pay them less, but they get to do 200, so they'll make up in the smaller margins. They'll make up in volume. I think that's what they were thinking.
Right. Yes. Yes. So, do you feel like the town of Palm Beach Gardens or the city of Palm Beach Gardens is supportive to the small business owner? Have you
Yes.
noticed?
Yeah, I think in this area, most of my customers are aware that it's an independent small business. They prefer that. I also, live here full time, so a lot of people, my neighbors, people in my neighborhood found out, I work here. A lot of them brought their stuff here if they had it. So it's a supportive community.
That's great. So do you find that patients would prefer to come here for the individual attention that you give rather than a big chain pharmacy?
I would hope so. The patients that do come here, they come here because they prefer to. Nobody's forcing them to come. There are a lot of choices. There's plenty of CVS's, plenty of Walgreens, Publix. Everybody seems to have decided to open a pharmacy at some point. So they have a lot of choices, and obviously the people who come here, this isn't right on a major intersection. It's a little bit tougher to turn in here at times. So they definitely, there's something that they prefer to come here than the big chains.
Yes. And you prefer provide patient education and teaching with the drugs that they receive?
Yeah, with every medication that's dispensed, each one we're required to actually offer counseling at the time of purchase. Most of them will decline this, but there are some medications where I feel even if they decline it, I'm still going to tell them about it, especially the first time they're on certain drugs. I have a list of things in my head that say whenever somebody's first starting this medication, I want to pull them aside and speak to them about it before.
Like a hypertensive medication, for example, or other things?
It could be a variation. It really depends on each individual person. I have to look at their age, look at what other medications they're on, look at their past history, and determine what it is if they do need a register.
That's very important. Do you see many uninsured patients here in this
Yes.
community? You do.
Yes.
Like what percentage would you guess?
Probably at least 20%.
Really?
Still don't have insurance or choose for whatever reason not to use insurance. Many of them might have medical insurance, but not necessarily prescription drug insurance. And then a lot of people may have been told that it's sometimes cheaper not to use their insurance, which somehow it seems to be true.
Cheaper to pay cash outright than go through the insurance sometimes?
Yeah. Somehow that seems to be happening. So here at the store, we're usually on generic medications are going to be cheaper than CVS or Walgreens.
Okay.
So sometimes if somebody was given a large co-payment, they may shop around and end up in here.
Oh, that's interesting. I didn't realize such a high percentage of living in this community would not have insurance, either health insurance or prescription drug coverage.
Sure. And a lot of the older patients, Medicare Part D that covers prescriptions, that Medicare savings plan, is still, everyone who turns 65, okay, because the plan is only about 14 years old. So if you turned 65 20 years ago, you didn't sign up for it right away. So a lot of those people decided never to sign up for it because maybe they had a really low price, which is an additional thing you have to pay for. So you do still see people like that.
Interesting. Well, I want to thank you, Chris, for the interview and your time. I really appreciate it. And it was
Happy to do
nice
it.
meeting you.
Nice meeting you too.
Thank you so much.